down to 2.1% at 2 years. Albert Lin then took this and combined with some of our patients as well and reported similar findings. You can see here revision surgery much lower and return to sport higher. When you look at contact athletes, look at the dramatic differences here. So even in contact athletes, remplissage was very effective. 21% with isolated vein cart repair, but when you add remplissage, only 3.2% recurrence. And he talked about that DTT distance, which I think really basically, as Tony said, shows the fact that it's really not one cliff you go off, it's a gradual decline. But I don't even think about this. I just do remplissage in these patients who are high risk. There's no loss of external rotation. Loss of external rotation occurs from tightening the anterior structures. We've looked at this in systematic review. This has just been accepted. 2,100 patients, no difference in external rotation between Bankart with remplissage, or Latarjet. Complication rate is lower with remplissage. We found that in our series here. We compared Latarjet and Bankart remplissage. You can see here the return to sport was actually higher than Bankart remplissage group in overhead and contact athletes. When we look at our complication rate, 6% with Latarjet, 0% with remplissage. Others have reported the same findings. Systematic review here, 1% complication rate with remplissage, 9% with Latarjet. Long-term, the outcomes, like I said, appear favorable. This is a study out of France. You see 10-year follow-up. And then we go out long-term. What you see importantly here is functional outcomes are very good in the Bankart remplissage group. And also recurrence was lower, 8%. Again, similar finding with Bankart isolated, 0% with remplissage. But look at the apprehension, 20% of patients. So that's probably a failure as well. So what are my tips? View from the anterior superlateral portal, place your anchors before doing your Bankart repair, and then I like going knotless to avoid going to the subacromial space. I think it's important to view from the ASL portal because you can look straight down. On the left, you see a posterior viewing portal. You're getting kind of a side view. But if you look at that anterior superlateral portal, you can look straight down and look at the defect completely. And that's going to be really important for anchor placement because if you want to appropriately tighten, you need to come perpendicular to that posterior soft tissue. Place the anchors before you have visualization. So here on the left, you see I'm placing my anchors at the beginning of the case prior to doing any labral work. If I wait and do my Bankart repair, I've tightened the anterior structures. You typically have some swelling. It becomes much more difficult to see in the back. So I make the decision right out of the gate, and then I do my Bankart repair, and then I come back and tighten my remplissage anchors. I like going knotless to avoid going to the subacromial space. This technique is actually why I started lowering my threshold because it became easier to do, admittedly. Biomechanically, Rob Hartzer and Steve Burkhardt have shown that if you use interlinked knotless anchors, it improves the biomechanics, so that's another benefit of this technique. So what I do is I place an accessory posterior portal. I go down below the deltoid, just above the posterior soft tissue. I think that's very easy to see. I place 2 anchors through that cannula, and then I can link them subsequently. This is the technique here. I'm viewing from the ASL portal. I have my posterior portal, then I take this accessory posterior portal. I clear the space, place 1 anchor inferiorly. I'll protect those sutures, come back in with a guide. This is a 1.8 millimeter knotless anchor. And then I'll go and do my Bankart repair, and then finally at the end I'll come back and my assistant and I will just trade our repair sutures and link those into the opposing anchors. So completely knotless, we get a double mattress configuration, complete the remplissage very quick. So in conclusion, remplissage reduces recurrence and on-track lesions. There's no loss of external rotation. The complications lower than Bristol Latarjet, and the long-term outcomes are favorable.